Wednesday, 3 November 2021. Online service to match job seekers to jobs. Thousands of job seekers will have access to free career guidance and employment advice to help match their skills to job growth trends, thanks to an $11.4 million investment from the NSW government. In launching Careers NSW today, Premier Dominic Perrottet said the online service aimed to get people into work faster with tailored assistance that included access to volunteer industry experts in network in and critical industries. NSW is the state of opportunity and has attracted businesses and industries from all over the world, strengthened by investments including the Metropolis and our record infrastructure boom, Mr. Perrottet said. Careers NSW will supercharge our pandemic recovery, ensuring every job seeker in NSW has online access to career advice, regardless of their experience or education, so they can take advantage of the job. As of the future, one-on-one access to dedicated careers specialists and more than 40 industry volunteers will be available in the pilot across 4 regions: Western Sydney, Southwestern Sydney, the Mid-North Coast and the state's Northwest, ahead of the full rollout in 2022. Minister for Skills and Tertiary Education Geoff Lee said the pilot will initially target 10,000 people in areas and scale up to include school students. From the middle of next year, the Careers NSW service will make lifelong career information accessible for all people seeking to upgrade skills or change careers, and guide them to the industries offering employment and opportunities, Mr. Lee said. The pilot program launching today enables residents in 4 priority regions to book appointments on the Service NSW website, receive tailored advice with a career specialist, and or talk to an expert already working in the industry they're looking to enter to set them on a pathway to employment success. Minister for Digital and Customer Service Victor Dominello said customers call Assist a self-service portal, which contains a number of resources designed to help people identify their skills, passions, and values, as well as learn about prospective industries. People want to make informed decisions about their career path, which is why we are making it easier to explore the industries and occupations they are interested in and the opportunities they present, Mr. Dominello said. This includes the ability for customers to compare courses and academic providers and find a study option that suits their learning preferences and location. Careers NSW was a key recommendation in the review of the NSW vocational education and training sector, led by Mr. David Gonski AC and Professor Peter Shergold AC, released earlier this year. Professor Peter Shergold AC said Careers NSW will help people navigate their LIFETIMEMPLOYMENT journey. It will also be the cornerstone of a comprehensive state-based career information and guidance ecosystem that will support people to make informed decisions, Professor Shergold said. To access Careers NSW, visit careersnsw.gov.au.
Good morning, I'm Dr. Kerry Chant from New South Wales Health with the COVID update for Wednesday the 3rd of November. There were 190 locally acquired cases of COVID-19 reported in New South Wales in the 24 hours to 8 p.m. last night, and it was really pleasing to see 114,000 tests performed during that period. It's going to be critical as we progress this phase of reopening that we maintain those testing numbers as high as possible. Across New South Wales, we've achieved 93.6% of people aged 16 and over have received their first dose of COVID vaccine, and 88.3% are fully vaccinated. In the 12 to 15-year-old age group, 79.5% had their first dose, and 63.7% are fully vaccinated. We've currently got 309 cases admitted to hospital, and 68 people are in intensive care, 32 of whom require ventilation. Again, the pattern in intensive care. We're seeing the majority of people in intensive care sadly have not been vaccinated. So a key message, please get vaccinated. Sadly, we're reporting the deaths of 4 people, 2 women and 2 men. 1 person was in their 50s, 1 person was in their 60s, 1 person was in their 70s, and 1 person was in their 80s. 2 people were from Western Sydney, 1 person was from Southwestern Sydney, and 1 person was from Queanbeyan. 3 people were not vaccinated, and 1 person, a woman in her 80s with underlying health conditions, had received 2 doses of the COVID vaccine. Again, can I extend my condolences to those who have lost their loved ones. Firstly, I want to take this opportunity to thank the community for getting vaccinated. We've done an extraordinary job in getting those high levels of vaccine coverage, but as you know, we have got a little room to do even better. We're really hoping to achieve that 95% double dose and to get there as quickly as possible, but importantly, to leave no one behind. So we need to make sure that we're reaching out to all our communities, and I call upon everyone in the community to reach out in their circle of friends, families, acquaintances, and just check if anyone needs extra help getting to a vaccine appointment or to getting vaccinated, has some questions or queries, and you can direct them to the health website for some information or ask them to speak to their GP. I think we all have a role to play in supporting everyone taking the opportunity that vaccination affords. If you're 18 years or over and received your second dose of your vaccine 6 months ago, you're now eligible to get a booster dose of Pfizer. So irrespective of whether you had AstraZeneca as your primary course, if it's 6 months ago, you need a Pfizer boost. So please book in at your GP, one of the state clinics, or pharmacists will be also having access to Pfizer, and get that booster shot. We know that immunity wanes, and whilst the protection afforded by the vaccine still against severe disease persist, it is important that you get that booster dose through that waning immunity, because of that waning immunity. Also, there's a group in the community that have underlying health conditions that mean that even the 2 doses of the vaccine in that primary course are not going to produce a very good immune response. So they're people, for instance, that have got particular cancers, are taking medications that are suppressing people's immune response, people that have on, for instance, dialysis. So if you have one of those chronic health conditions where you know your immunity is lower, and check with your doctor, because they might also advise you having a 3rd dose as part of your primary course, and that can be given around 2 months after your second dose. So please just check with your healthcare provider whether you need that 3rd dose in your primary course if you have those underlying health conditions. And can I just say, I've been so pleased with the uptake in the 12 to 15-year-olds that have come forward to get vaccinated. Stubbornly, we're seeing this sort of taper off a little bit around that 80% first dose level. Can we do that last big push? Having children in high school, particularly highly vaccinated, will help us keep schools as safe as possible. So it will protect your child. It will also help us protect others around your child. With fully vaccinated international travellers returning to the country without quarantine, regional travel returning, other restrictions easing, it's going to be important that we maintain COVID-safe behaviours. We are moving into a phase of living with COVID. It means that we can enjoy many of the things that we've missed during those hard periods of lockdown, but it is important that we continue to wear a mask where it's required, particularly in indoor settings. We need to practice that physical distancing, particularly again in indoor settings, maintain that hand hygiene, and always check in using the Service New South Wales app. But importantly, if you have symptoms of COVID, don't go out and about. Get tested, stay at home, and get hopefully await that negative test result. I want to also call out particularly to the communities of Moree and Inverell. The risk of community transmission is increasing in those sites, and a big urge and call out to those communities: get tested, follow the public health advice, and get vaccinated. We know that there's been improvements in the vaccine coverage, but there is a significant group of the population that is still yet to be afforded the protection of vaccines, and I'd like to see that vaccination coverage in those areas increase as soon as possible. Thank you, everyone, and please stay COVID safe.